that the scene is safe. And I will wash my hands, follow the 7 steps of World Health Organization. Palm to palm, back of the hands, interlace, interlock, interlock, thumb, thumb, fingertips, fingertips, wrist, wrist, and let it air dry. And I'm happy to approach my patient. Hi Mira, I'm back. I'm Audrey, I'm your nurse for today. How are you doing?
Not too bad.
That's good. So I'm here, Mira, because I need to give your 12 noon medication for today, 17th of February, 2023. I will be asking a couple of questions, like confirmation of the your name, date of birth, and allergies. Okay?
Yeah, that's fine.
Perfect. So Mira, could you please tell me your name and date of birth as I counter check in your ID band first?
Yes, Mira Abaloni. My date of birth is 1/1/1994.
And your MRI number is 123456X, so thank you. I can see that you have a red ID band. It says that you're allergic to penicillin and brufen as well. Is that correct?
Yeah, that's correct.
What happens when you take them?
I get bronchospasm when I take brufen, and then an anaphylactic reaction for penicillin.
Thank you for confirming that. I can see here that it matches my documentation. So what I'll do, Mira, is I will read the chart to you as well, just to confirm or to let you know what are the tablets that you will be giving.
Okay.
Is that all right?
Mm-hmm.
Perfect. So first is, we have Mira Abaloni in my address graph, date of birth, as mentioned, 1st to 1st 94, hospital number 123456. Ward is surgical assessment unit, admission today, 17th of February 2023. Your height is 1.56 meters and 47 kilograms, is that right?
Yeah, that's correct.
Perfect. And your consultant is Dr. A. Richards. You were admitted at 8 a.m. earlier.
Yes.
Perfect. So I can see, I will double check first if all the addressing graphs contain the same information. Okay. So I can confirm that all the details in my addressing graph are correct, so I'm happy to proceed. It's all the prescriber has a signature here, Dr. P. Wright, with his GMC number, signature, and bleep number, and details of person administering medication as well. Almadel was signed here with her initial signature and her base at accident and emergency unit. And as confirmed earlier, your allergies of penicillin, which causes anaphylaxis, and brufen, which causes bronchospasm, signed by Dr. P. Wright, bleep number, signed today. So I'm going to proceed. In your stat doses or once only medication, you were given morphine sulfate and for your pain, and cyclizine for your antiemetics, as mentioned in your scenario, in your situation earlier or chart. How are you feeling at the moment?
I'm feeling a little bit better.
Better, so that's good to hear. So you've taken this at 20 to 8 in the morning, so that's good, and you've confirmed that you felt a little bit relief from the pain and nausea, yeah? So prescribed oxygen. It says here that my patient is not a carbon dioxide retainer. The no has a tick and no other prescription in my chart, so I'm happy to proceed to the next page. In my antimicrobials, you are prescribed amoxicillin, and that is due at 12 noon. But I know that you're allergic to penicillin, and this contains penicillin. So even though the prescription is correct, I'm not going to give this because you're allergic to it. So I'll bring this up to the doctor and see if he could review your chart and prescribe you a substitute antibiotic that you're not allergic with, okay?
Okay.
So what I'll do is, I'll just document that later on. There's no other antimicrobials listed here. For your regular medications, your ferrous sulfate is actually listed here, 200 milligrams twice a day, but it's not due my time, not until 6 p.m. later. So I'm gonna proceed on to the next page. For your as required medication, you've got a paracetamol, which is for your pain. Do you have a pain at the moment?
Still, I do have pain, yes.
You do have pain. Do you want to take your as required, your paracetamol, or?
Yes, I would like to.
No problem. So what I'll do is, since it's an as required, and you actually, it says here at 8, there's a code of 5. And a code of 5 means stat dose given, because you've had your morphine sulfate. So at 12 noon, I can actually give your paracetamol. Since your weight is 47 kilogram and the dosage is 500 milligram, so I'm happy with that, and it says 4 to 6 hourly. prescription is for today, 17th of February 2023. Route is per orum, duration for 7 days. Start date today, finish date for the next 4 days with the signature of Dr. P. Wright, plate number. And I can confirm that this prescription is signed, valid, and legible, and it even have a pharmacy check as well. You have a salbutamol here prescribed for today to relieve, I think, whenever you have your asthma exacerbating. How are you feeling at the moment?
I'm okay for now.
You're okay. So do you want to take this or not?
No.
Right, no problem. And after that, in the infusions, you had a normal saline infusion today at 8:30, and it finished at 10:30 because we're now already in 12 noon. And you've had a total of 500 mils, and there's no follow through for the next IV, but if ever there is, I will just confirm with the doctor.
Okay.
Lovely. So now that I have completed reading your chart, what I will do is, I will prepare the medications. I will come back. Okay? So what we'll do is, before I prepare that, I know my tablets and paracetamol is for pain, and the amoxicillin I'm not gonna give it, but I'm gonna use my BNF chart just to double check what are the common side effects for the paracetamol for the patient. So when you open your BNF, make sure that you do open it to the right page. I think in other test center, you will have a tablet where you just have to type the name of the drug, or sometimes they will have, I think, a laminated charts already pre-prepared for you. But for this video, we have a BNF book that we will refer to. Right, and my common side effects here is gastric upset, diarrhea, but these things, Mira, they're rare to occur. But if ever you feel that way, you just let us know.
Okay, I will.
So now that I done my BNF already, I've checked my BNF, I'm happy to proceed. For the purpose of training, we will assume that my tray is disposable. But when you're at the test center, you ask your assessor if your tray is disposable or reusable. Sometimes when they brief you, that's why it's very important that you listen to their candidate briefing. Before you start, they will tell you whether all your materials are disposable. My tray is disposable. I'm happy to proceed. When we train our nurses, I ask them to still wear PPE when preparing their medications, even though it's not in there, it's not in the marking criteria. So it's your prerogative or it's your preference as to when you will wear a PPE in preparing your medication. But remember, this is all part of the safety checks or patient safety when you administer a medication. So now, what I will be giving is just the paracetamol 500 milligram for my patient. I can see that paracetamol 500 milligram with expiration date of November 2025, dry, intact, and no punctures as well. So I'm happy to use this. I'm gonna take my medicine pot, get 1 tablet, I'm gonna put that away, and then I will have a glass of water for my patient as well to drink. So now I am happy to proceed to my patient. So hello Mira, I'm back. Thank you for waiting. So I've got here your tablets, but before I give that, could you please confirm your name and date of birth?
Yes, Mira Abalone, 1/1/1994.
Lovely. And I know that you are allergic to penicillin and Brufen. We're not giving your amoxicillin today, just your paracetamol, which is for your pain. I've given you the side effects. It's good that you're sitting upright. Do you have any swallowing difficulty?
I don't think so.
Right. Could you just have a little sip of water for me, just for me to double check? Perfect. So okay.
Yes.
Lovely. You've just got 1 tablet to take here, your paracetamol. And that is your water. Perfect. Have we swallowed that?
Yes.
Could I please check if you could stick your tongue out for me? Perfect. So my patient has already swallowed the tablet. Since these are all disposable, I'm gonna dispose all my materials. We might want to wait about half an hour to an hour for the tablets to take effect, and then I'll come back just to reassess your pain again, okay?
Okay.
But if you have any questions or anything that you would want to ask us, just please press your buzzer.
All right.
So what I'll do now, Mira, is I will document before I leave your room. Okay, so now that I have signed you the documents, Mira, are you happy for me to leave the room?
Yes, I'm okay.
Lovely. So I'll come back in about half an hour to an hour just to check how your pain is. Okay?
Okay.
And I will update you what the doctor will prescribe in substitute of the amoxicillin.
All right.
Right. Thank you so much for cooperating with me. And I will end my station following the 7 steps of World Health Organization. Pump to pump, back of the hands, interlace, interlock, thumb, fingertips, wrist, and let it air dry for another 20 to 30 seconds.